Hi, my name is Jennifer Shifferd, and I am a physical therapist at Michigan Medicine working in pelvic floor physical therapy. I'm going to introduce exercise for your gastrointestinal health today, and just kind of let you know what's the latest information and how to exercise when you have GI disorder. There are general health benefits that we know of from just regular exercise. We know that it reduces the risk of cardiovascular disease and of endocrine disease. It improves the strength of the heart muscle. It helps reduce the chance of getting diabetes because your muscles are using that glucose as a fuel. And so insulin gets a little bit suppressed. And so thereby it helps control the sugar levels. Muscle and bone health is also achieved through exercise. We build muscle mass to help provide support to arthritic joints. And with bone health, we participate in exercises that cause forces in multi-direction, which helps to strengthen our bone integrity. So this is a picture of my 18-year-old son playing soccer in his high school year. He's a goalie. Making an awesome catch, and it just kind of is one of those sports where they're all over the place on the field and jumping and doing crazy movements, and that really helps to build good bone health. We also know general health benefits from exercise also include improved sleep, and it helps reduce anxiety and depression. What's the impact of exercise on your GI system? So in general, exercise can improve our gastric emptying and lower the risk of colon cancer because stool is sitting and things are moving out of us. We're getting that waste out of us. Generally, light to moderate exercise is typically well tolerated, and it's beneficial for patients that have inflammatory bowel disease and liver disease. Research is showing severe exhaustive exercise inhibits that gastric emptying, and it interferes with the gastrointestinal absorption and can cause a lot of GI symptoms such as nausea, reflux, abdominal cramping, and occasionally GI bleeding. So let's talk about GERD a little bit. So GERD is gastrointestinal reflux disease. It's a common thing that can happen, especially amongst trained and non-trained runners. Strenuous exercise can cause belching, abdominal fullness, regurgitation, heartburn, and even chest pain that simulates angina. And a lot of athletes, 45 to 90%. The typical reason why running is more aggravating with GERD is because it's more vigorous. So there's more body movement, and that's what studies are showing. And so reflux is more common, occurs more often, and longer duration. So with stationary bike riding, this is what's recommended because it achieves aerobic training with a little body agitation. So you're more stationary. You're not moving all around like you are with running. And according to the studies, it shows the least amount of reflux. So if reflux is something that you're suffering from, this is one way you can still get a nice aerobic exercise and still have the health benefits, but less symptoms. How do I reduce the symptoms of reflux with exercise? So it's generally some common sense, right? We don't want to eat right before we exercise. If you do, you're going to have more symptoms of reflux. So it's generally recommended that you fast before you exercise. Cycling is recommended instead of running, again, because of that less body movement. So if you have access and this is something you could do, this would be recommended. So if I have inflammatory bowel disease, that's another significant condition that can contribute to not wanting to exercise. So what is it? It's an umbrella term used to describe disorders that cause chronic inflammation. There are a couple of types. There's Crohn's disease and ulcerative colitis. So Crohn's disease is inflammation in the lining of your digestive tract, and that can spread deep into the affected tissues. Ulcerative colitis is just kind of like it sounds. It's going to cause long-lasting inflammation in sores or ulcers, and the lining of the large intestine, which can be very uncomfortable. Low intensity and low impact exercise in moderate duration, like light walking a few times per week, was showing promising results in research studies. So this is generally recommended and shouldn't be harmful and will give you an avenue of exercise. So with gastric emptying, let's define it. What is gastric emptying? It is the time it takes for food to empty from your stomach into your small intestines. So with low intensity exercise, this has been shown to actually accelerate the gastric emptying. So this is recommended because vigorous exercise actually slows it down. And so if you're having already some trouble, like with gastroparesis or a slow movement of that food getting to your small intestines, it would be better for you to do a low intensity exercise instead of a real vigorous exercise. And you might find that you tolerate it better. So constipation and exercise, I really didn't find a lot in the research that supports that exercise increases our motility of our GI system. What they are showing is that with vigorous exercise, it's slowing it down. But then afterwards, there's a surge of blood that's coming back to our intestines. And so then that propulsion kicks back in and actually speeds up a little bit. So things are moving, but not necessarily encouraged when we exercise because the blood is shunted away from our GI system. There was some research that I found that supported low intensity physical activity as a treatment for some types of constipation. So, we all know if we are sedentary, things don't move as well. And even just general daily physical activity is going to be beneficial than being sedentary. So movement is key. So general walking, biking, swimming, those non-impact kind of exercises, yoga with diaphragmatic or belly breathing is really beneficial because when we do belly breathing or diaphragmatic breathing, our diaphragm is moving up and down when we breathe in and out, and that actually massages the colon and it helps to move stool through. So it's really important to kind of learn how to breathe from your belly. So if you try to put your hands on your lower rib cage and just offer a little bit of compression and then try to breathe in, you should feel your hands getting pushed away or separated. And so that's breathing from our diaphragm. It's really important to learn, especially if you're having constipation, because you could do belly breathing with different yoga positions and stretching maneuvers to help move your stool through. So that's just a couple things you can do to help with constipation. A lot of my patients will say they have diarrhea and urgency, especially my runners with exercise. Diarrhea and urgency, so urgency is needing to quickly find a bathroom within minutes after feeling an urge to poop. Like you barely can hold it. You're worried, you're looking for that bathroom. And this can occur with long distance or marathon runners. So what happens? During extreme exertion, there's a decrease, like I said earlier, in that blood flow to your small and large intestine, and that can decrease the absorption of our nutrients that we pull out of the stool and impair the water that gets reabsorbed out of the stool so it can form into the solid poop, and that can cause diarrhea. If you have bleeding and persistent diarrhea, you should consult your physician because this could be a more severe condition. If the symptoms are just mild, then you might want to just try altering that exercise routine and reduce the exertion to see if your symptoms improve. So what's your target intensity with exercise? In general, we like to use this scale called the rate of perceived exertion, and we want you to target that green area on this slide. So where it's somewhat hard, not hard, but somewhat hard. So somewhere between 13. And how do you know you're there? When you're exercising, it should feel like you could still carry on a conversation. And this is a good way to know, okay, I'm not at too much of an extreme level. Because if you already have bowel issues, you really do need to be careful to stay out of that real vigorous exercise range. Let's put it all together. First off, you want to find an exercise you enjoy, okay? We all have something that maybe we gravitate to more. I was a rower in college. I still love to do it, but I don't like to row on a machine. So I much prefer in the water. You know, if you're someone that likes to walk and you can take advantage of the weather in the summer and get outside and walk, that's your exercise. You know, if you're a biker and you like to bike, that's great. If you have someone, you know, if you're someone that has GERD, being on a stationary bike would be better for you. Maybe even walking, something that's a little bit less vigorous of a movement. Mix it up, but be consistent. Exercise most days of the week for about 30 minutes. You want to achieve that intensity level with exercise that's somewhat challenging to you, but you can still carry on that conversation. If you need a motivating factor, I know I do. If I don't show up to row with my girlfriends in the morning at 5:30 in the morning, someone's going to be mad. So it is helpful to have that exercise buddy, but we all don't have that. And so if you don't, set a goal that you know you can achieve. Make it simple, just to get you going and get you moving. Listen to your body, most importantly. If you're in pain and you're feeling those GI symptoms and they're getting worse, then back down on that intensity. Try that first and see if you can just modify that exercise a bit and improve your tolerance. But if symptoms do persist, that's a red flag with exercise. You should consult your physician and so they can help you. So what can physiotherapy do for bowel dysfunction or pelvic floor dysfunction? We treat everything. We treat urinary incontinence, pelvic organ prolapse, pain, you name it. We see patients post-surgically as well. So your pelvic floor muscles, they play an important role in maintaining your bowel and bladder continence. They also provide support to your pelvic floor organs, and they aid in sexual function. So these are important basic functions that we should have. And when we have something that disrupts that, whether it's weakness in the muscles or pain, or maybe there's also back involvement or hip injury, that can interfere with these normal functions because the muscles might get tight or they might get weak. And physical therapy can address all of that. So if you're experiencing the following bowel symptoms, you can ask your physician assistant, your midwife, practitioner for a referral to seek out a physical therapist near you. So if you feel excessive straining with bowel movements and you don't empty completely, have the urge to poop, but no success in passing, you have pain prior to, during, or after a bowel movement in the rectal region and or abdomen, uncontrollable gas that you can't contain, leakage of stool that occurs with or without warning, and a feeling that part of your rectum might be falling out after you have a bowel movement. We call that a prolapse. Then those would be key indicators for you to seek out a physical therapist and ask your physician or physician assistant, midwife, or nurse practitioner for a referral. So how do I find a pelvic floor physical therapist near me? These are actually 3 really wonderful resources of national organizations that have pelvic floor physical therapist information and PT locators. So you can locate a physical therapist nearest you so you can begin your care. So these are a couple of additional resources for you, national websites that you can find more information about GI disorders and exercise. Thank you so much for listening today and for having me be a part of this educational opportunity. Thank you.